Welcome everyone to today's webinar. I am Laura Deirdre with Becker's Hospital Review. We will begin today's webinar with a presentation, and we have time at the end of the hour for a few questions during a question and answer session. You can submit any questions you have throughout the webinar by typing them into the Q&A box you see on your screen. We look forward to hearing your questions. This session is being recorded and will be available after the event. You can use the same link you used to log into today's webinar to access the recording. At this time, it's my pleasure to start today's webinar by introducing our presenters. Jeffrey Swanson is the head of sales at Pharma Logistics, a reverse distribution company headquartered in Libertyville, Illinois. Pharma Logistics takes unsaleable, expired drug products from independent retail pharmacies and other healthcare providers and returns them back to the manufacturers and/or wholesalers for credit, which is returned to the pharmacy. Jeffrey joined the company in 2016. Prior to assuming his current role, he led the company's reconciliation, customer advocate, quality control, and business development teams. Before joining Pharma Logistics, he was Assistant Director of Sales and Marketing and a product consultant for TCG RX, a leading supplier of pharmacy automation. Jeffrey holds a BA in Communication from the University of Wisconsin-Stevens Point. At this time, I am pleased to turn the floor over to Jeff to begin today's presentation.
Thank you very much, Laura. I appreciate the introduction, and thank you everybody for joining us today and taking the time out of your busy schedules of running your facilities to learn about big data and how we can use it to help improve our pharmacies, especially in this year of 2020 that's unlike anything that we have really ever gone through as a nation here in recent memory at the very least. So I'm really excited to pass this information along to you and looking forward to the questions at the end of the day. So I'm going to go ahead and jump right into it now. Pharmacies are currently in a state of pseudo-recession. And what that really means is that pharmacies have been one of the hardest hit areas in the healthcare industry because of the COVID-19 pandemic. According to the NCPA, nearly 2/3 or 66% of pharmacy owners are currently experiencing negative cash flow issues as a result of the pandemic, and that makes sense. We're seeing revenue lines shut down in hospitals, elective surgeries aren't happening, in retail pharmacies, customers aren't going out. So we're seeing these negative impacts come across. And unfortunately, what we're hearing is it looks like things are going to get worse before they get better, especially as we start to enter the flu season coming up here, already or very shortly at the very least. However, there are some positives that we can be looking for. And the one that we're going to talk about today is big data and how does that have the power to level the playing field and help pharmacies through this downturn. And what we're really going to be focusing on are three key issues: reducing cost and optimizing cash flow, improving operational efficiencies, and making more confident data-driven decisions. Essentially, how can I, instead of talking in feelings and I feel like this is happening a lot and I feel like this happens often, and replace that with 90% of the time this is happening. 9 times out of 10, I have patients requiring this. And then I can make decisions based on the fact instead of feelings that I'm having. So through the course of this webinar, what we're really focusing to help you understand are key industry pain points and how they impact your pharmacy's profits and cash flow, the data that you should be collecting, and a lot of this you already are, and how to leverage big data in order to improve your pharmacy. So jumping right in, the concept of big data in pharmacies. What is that? What does that mean? Big data, it's for providers and pharmacies are already constantly collecting large amounts of patient data. This is your normal day-to-day operations. And a lot of the time, it's happening behind the scenes or it's already automatically happening. And you have the information, you're just not utilizing it in a way to help you make data-driven decisions. So when we think of what this looks like in general healthcare data, it's something that along the lines of patient identifiers, vital signs and diagnoses, clinical outcomes, or insurance information. Flipping to more of a pharmacy-specific data, we start looking at prescription counts, open claims, revenues per prescription, and refill frequencies are four of the main ones there today. With all this information that's being collected, those large data sets are known as big data. And they can be used to reveal patterns, trends, valuable insights into patient behavior that are meant to benefit you as a pharmacy. More information, the goal here is for more information to lead to better answers. And the simple way to think of this is the more we measure, the more we can improve because we know what we're looking at. Lord Kelvin, we're going all the way back to the 19th century here, who was a scientist and a mathematician. He put it really, really simply. If you can't measure it, you cannot improve it. And as we're talking through big data and the impact it's going to have on your facilities and your businesses, this is really the key to what we need to be focusing on. If you don't know what's happening and if you don't have a way to record what's happening, how can you possibly act on it? And how can you have actionable items coming from it? So the question that we have to be asking ourselves, if we're collecting this data and this data is being automatically driven to us from our patients and from our businesses, why aren't we using it? And the biggest obstacle for this is it's a lot. The sheer volume and the lack of strong analysis technology has made it difficult. To put it very simply, there's just too much data out there, too much to decipher and have meaningful conclusions, until now. And that's because of the technology is changing. And technology is rapidly growing to have data capturing technologies that pharmacies can now translate these big data sets into actual valuable and valuable information. So, some examples of where information is improved are the EHRs and cloud-based platforms, the administrative claims information, and clinical decision support databases. When we're looking at analytics software that can help you gather large sets of data into an easy-to-digest place, this is actually really vital to success here. There's a lot of tools out there that can take this. Having 90 pages of line-by-line data versus having a visual dashboard that's going to display drug analytics, stats that allow you to quickly and efficiently see where you're succeeding and see where your problems are. It's a difference maker. Having that data presented to you accurately and efficiently is going to make you, one, want to actually look at it, and two, allow you to take those actionable steps. By leveraging advanced data analytics, you can analyze the benefits of different pharmacy services in order to improve several important areas of your pharmacy. It allows you to say, this is where I'm making money, and this is what I need to continue doing. This is where I'm losing revenue and what I need to stop doing. Or this is right as efficient as we can be, and we need to hold that middle line, and we're going to continue as we are. The pieces that you need to look at as you're looking at big data. But at the end of the day, you need to know what information to pay attention to. And leveraging big data is about more than just analyzing every statistic you can. We just touched on the fact that there's a lot of data out there, and you can have an analysis paralysis if you start looking at it all, and you start trying to look at every single piece of information coming at you. You have to be smart with your selection and know that not everything is worth evaluating. And it may be simply not everything's worth evaluating ever, or not everything's worth evaluating right now. What are the pieces that are going to impact my business in the biggest way, and how can I bubble them to the top of my list from big data? So we've been talking a lot about the concept of big data and what the pieces are. Now, I want to dive into what type of data do you need and what can we be focusing on here. So we touched on this a little bit earlier. And every pharmacy, no matter the size, no matter the facility type, should be gathering information on prescription count, open claims, revenue per prescription, and refill frequency. And I'm going to spend a little bit of time diving into each of these individually to give a little bit more insight about what we should be collecting and the benefits of those data points. So starting with prescription count. When you're looking at prescription count, take into account of how many scripts are filled each day and each week, the difference in volume of filling prescriptions on different days of the week. Is there a certain drug that's more likely to be filled on a Sunday than a Wednesday? Are there certain days of the month that you're going to be filling more? Is it the 1st of the month? Is it the 30th of the month? Which days are your techs overburdened? If you have a MedSync program, for example, and you know that you have a lot of your customers on a sync program that has them being filled on the 15th of every month. Do you have the staffing level to support that? And which days allow for more value-based care initiatives? Do you have the ability, by looking and saying we have MedSync and we're filling consistent number of scripts every single day of the week, but if we realign some of our patients to certain days, that allows me to really focus on an MTM program, for example, on Mondays and Fridays or Wednesdays, so that I can be taking care of these value-based care initiatives with my customers and having a different level of communication with them. Open claims. You need a positive cash flow to keep your pharmacy running. It's probably the easiest thing to wrap our head around on this presentation today, that positive cash flow means we get to stay open and we get to stay running. Patient care, of course, is utmost important to us. But at the end of the day, if we don't have positive cash flow, we're not going to be around to provide patient care. So when you're looking at open claims, once your patient has their medication, how long does it take to receive payment from their insurance? Don't let that revenue slip through the cracks, and make sure that you're on track to be paid on paid claims or open claims. Another piece that you want to look at in this is not only insurance claims, but also your reimbursements from PBMs, for example. How long is it taking you to be fully reimbursed, if you are being reimbursed, and at what level, so that you can be making adjustments and you can be saying, I know that my cash flow is going to ebb and flow in this way based on my patient count and my claims that are being processed, both on insurance and on reimbursement side. Revenue per prescription. You'll want to track the revenue for each prescription sold, the prescriptions that offer the most profit, which prescriptions you're selling at a loss, and understand that not every drug is going to bring in a lot of revenue. Understand that your biggest revenue opportunities are imperative to maintaining high profits and recognizing loss before it happens. Some of this you can control, some of this you can't, but again, the data that you're going to be driving is going to paint a better picture and give you more than just feelings on how your pharmacy is performing over the course of time. And finally, your refill frequency. If your patients aren't refilling their medications regularly, that means they're deviating from their medication plan. Late refills are more than just lost revenue. They can be detrimental to patient health. And we just talked about patient care and patient outcome is what we drive here. It's what we need to be focused on. To keep your patients on the right path, we need to make sure we're tracking how often patients are refilling their prescriptions, and not only refilling them, but refilling them on time when they're late, and especially by a week or more. The occasional patient isn't going to have perfect medication adherence. They're going to miss a day or two unless they have an adherence pouch packaging and a MedSync program, for example. But if they're missing consistently and they're going from what should be 12 refills a year to 8 refills a year, are they going to be having readmission issues? Are they going to have relapse into the same disease that we've been treating? Are they going to be impacting their own well-being because they're not taking the medication as needed? And on the pharmacy side, how is this impacting your revenue? If you have a year customer that you're expecting to be refilling every single year or every single month for 12 months, and they're only doing 8, how can I get them to increase their fill frequency to 11 or 12 so that I can capture that additional revenue with that patient also being taken care of? So now we've talked about what data we're looking to collect, and the next question that just comes up is, what can I do with this data? So once you've collected the data, and anything else specific to your pharmacy specifically, you can turn this knowledge into results or actionable items. You can use big data to help with the mitigating the effects of drug shortages, managing the reverse distribution process, optimizing operational efficiencies and costs, improving patient care and medication adherence, or fostering customer engagement and loyalty. So starting with the mitigating the effects of drug shortages. We all know drug shortages are a major problem for pharmacies right now, and it's being impacted more by COVID-19. In fact, the FDA is actively monitoring the impact that COVID-19 is having on this issue. According to a study from 2019 from Vizient Drug Shortage Task Force, drug shortages are costing facilities at least $359 million per year from the cost of increased labor alone. a huge number when we're thinking of the impact that these drug shortages are having on our facilities. And just to be clear, that's 100% of those surveyed, of the 365 participants, also reported that their facilities were negatively impacted by drug shortages in some fashion. Is that maybe the possibility of losing that patient to another facility who can fill the prescription for them? Is that a negative patient outcome because they don't have the medication on hand? There's a ton of ways this can impact your facility, but it is impacting every single one of you every single day. So, while the root cause of drug shortages can't be removed by big data alone, and when we're really clear on that, just having data isn't going to fix drug shortages. It's not going to be this miracle pill that tomorrow you have all the drugs that you've been looking for the past 2 years. But gathering information can help protect your pharmacy. And you can use big data to track drug shortages to see exactly when and why they occurred, prepare for forcing shortage by stocking up on drug alternatives, or even providing information to the FDA for a better unified regulatory response. Providing that big data up the chain so that it's not just your data that you're using, but all of a sudden it's a system, and then it's a region, and then it's the nation, all giving the big data to the FDA. Looking at the reverse distribution process, by taking advantage of this process, you can earn credit for your expired or unused pharmaceuticals. When we're thinking big data in terms of reverse distribution, you can help manage and optimize benefits by predicting which drug supplies will become expired based on buying habits, minimizing your excess inventory by stocking too much of an unpopular drug, looking at our formularies, figuring out are our par levels accurate? Are we buying the right pack size? If I'm returning 8 constantly and I'm buying a pack size of 10, but I could buy a pack size of 5, can I return less because I'm buying the proper pack size now, not just the one I've always done? There's a lot of information for inventory management and actionable items for your pharmacy that can be seen from this data stream from the reverse distribution process that in the grand scheme of things right now isn't actively being used regularly. Which moves us into that optimizing operational efficiencies and costs. Taking a look at inventory control, which of course is a critical part of your pharmacy's ability to manage patient care and uphold your bottom line, big data allows you to more accurately track and manage inventory so that disruptions don't occur. Big data also allows pharmacies to capitalize on bulk buys and special pricing offers. Inventory is a tough beast in the pharmacy world. We always want to make sure that we have it. We want to make sure that we can take care of the patients, and especially when we're thinking in terms of the impacts that drug shortages are having on our facilities. At times we're buying because we need something, we want something, not because we need something, because we don't know the next time this medication is going to be available to us. That makes sense, and that's something we have to acknowledge in the current state. But taking a look at those drugs that are available, and are we purchasing them correctly? Are we purchasing them because we feel that we need to? And I've always purchased this way, so I'm going to continue purchasing this way. Big data can really help us look at the way that we're changing that. And then improving care and medication adherence. Pharmacists are some of the most trusted professionals in the United States. According to Gallup's 2018 annual survey, pharmacists are ranked 3rd in terms of honesty and ethical standards. Pharmacies can use that trust to become an integral part of their patient care, and using big data can make care suggestions on elements like diet, supplements, drug education, and even medication adherence. Using the information that we can collect from our patients on their care can be turned around to be used back with the entire group for greater care opportunities. And that really transitions into fostering customer engagement and loyalty. Across every industry, customers respond better to targeted, more personalized marketing. Big data can help you deliver a better customer experience by monitoring purchasing preferences. That way you can help patients find additional savings and better utilize their coverage plans. You can also use your customer data to deliver targeted coupons, special offers to patients so that they continue to choose your pharmacy. Again, we touched on this. Patient care is what our goal is. But we can't ignore the fact that we are a business and that for us to offer that patient care, we have to drive revenue. Fostering that customer engagement and loyalty is going to be vital to ensuring that you can be successful in that goal moving forward. Now, we've talked about what data we should collect, how it's going to impact us, and now really to wrap it all together, it's harnessing the power of big data. You have this collection, you have these pieces, and now you have a way to take actionable items out of them. Through the power, and it's really simple, through the power of big data, you can improve your operation, optimize your cash flow, and make more confident decisions to improve your patient relationships. At the end of the day, doing these things are going to stop you from falling victim to the current downturn and put you in a position where you're going to be able to come out of it stronger than you were in the past with facts instead of feelings and a data set that's going to tell you how you can take actionable steps within your own business. Use big data to help keep your pharmacy thriving now and into the future. Do have a list of references for the information that we went over on today's presentation. This was recorded and this will be provided to you at the end of the presentation today. So you can definitely find out more information through the links that are on the screen now. I want to thank you, everyone, and Beckers for inviting us to have the conversation with you today around big data and the impact that it can have on your pharmacies. And I look forward to the questions we have and look forward to seeing all your facilities thrive through the use of big data now and into the future. Thank you, everybody.
Thank you, Jeff, for that fantastic presentation. We will now begin today's question and answer session. Please submit any questions you have by typing them into the Q&A box you see on your screen. We will try to get through as many questions as we have time for. And we do have a few questions lined up here ready to go, so I'll jump right in. Jeff, the first question is, it still seems like many of the benefits of big data will be reliant on the patient playing along. How do I help ensure the patient compliance?
Yeah, it's a really good question, and at the end of the day, it may feel that way. It may feel like we have to have the patient's buy-in, that we have to get them playing along, as you said. The fact of the matter is a lot of this data is already being driven to our pharmacies and to our businesses just through normal interactions with the patients. And when we're looking more specifically at like patient adherence, which is really where they're taking their medications on time. Most patients who aren't refilling their prescriptions on time aren't doing it because they're not doing it because they don't care. It's often because of one other reason. They're either too busy and they forget, or they're worried about cost. And the first is very easy to handle, relatively. Reminders to help them stay on track. Exploring a MedSync program so that you can refill all their prescriptions on the same date throughout the course of the month versus relying on them coming in 3 times to get 3 separate prescriptions. For the more stubborn patients, considering adding small incentives so that they stay on track for X months in a row, an incentive-type program. I don't want to make it as simple as the punch card, but that's kind of the concept behind it. You get 5 cups of coffee, you get your 6th cup for free. That idea resonates well with consumers. The latter, though, the worrying about cost, that's a little harder. You can't control the patient's financial or insurance situation. If you know or suspect that there's a cost worry, though, you can see if you can find a happy coverage medium with their insurance company. Again, this is where the perception of the pharmacist being trusted in the world is so important because we want to take care of those patients. We want to help them as much as possible. The other piece is visual attractive charts, infographics, and statistics can help internally, showing the patient the importance of their care and how adherence to their medical program will help them live better. So you can use your own analytics and you can work with a partner or a marketing company to really put together some of that information for patients.
That's great to know. Thank you so much for laying that out for us, Jeff. We do have another attendee question here, and it is, this attendee says, it seems this is a retail focuses. Do some big data metrics or focus apply to the hospital pharmacy as well?
Yeah, really good question, and they do. And there is, when we're talking patient adherence, that is going to fall more on the retail side, absolutely. The main difference, of course, is when a patient is in the hospital, you can ensure they're taking their medications. We can really follow up with that patient care and that we can make sure that they're staying compliant to their medication. When they leave, of course, that's where it becomes more difficult. When we're looking at big data for hospitals, though, a lot of this does really fall in line with that. Looking at your number of scripts that are being filled on a day, looking at the type of patients that are coming in, trying to ensure that you have a good understanding of what type of surgeries are being provided and what does that mean for discharge medications and what does that mean for inpatient medications that we're going to be focused on. So there are data points that are definitely involved in the hospital that are very similar to the ones that we touched on today. It is going to be just slightly different based on the fact that you're dealing with a consumer base or a patient base that is in more of your control and that you're going to be able to ensure from an adherence standpoint are following along. But reimbursements, insurance issues, all of that data still is going to happen at the hospital level. It might not be, it may be handled in a bigger way if they're staying for an entire inpatient stay, but you're still having to deal with those reimbursement rates and you're still having to deal with cycle fills and the insurance payments that are going to be coming on the back end as well.
Got it. And we have a follow-up question to that as well. This attendee says this sounds good, but how do we get the data and evaluate it?
Yeah, absolutely. So this is where taking a look at the vendor partners that you have in the industry, taking a look at the internal software and the internal collection capabilities that you already have come into play. Some of your pharmacy information systems might already be collecting some of this information. Some of your internal accounting and finance teams may already have some of this information, and this is where we're really looking at, when you know the data is there, how do we communicate it between the groups that really need it, and how do we make it into a format that is actionable? So the way that I always approach it is, first and foremost, let's take a look at our current status, our current state, understand the current tools that we have in place. Is this data being collected? Where is it being stored? And then from that conversation, maybe I explore to find a different vendor who can provide it, have conversations internally with different departments to see if they're collecting it as well, and then taking those steps up and downstream to make adjustments if and when needed. But my first step and my first recommendation would always be start internally and see what of this information is already being collected through software, through programs, and through current vendor partnerships you have, and then move on from there once you start getting those answers.
Got it. That makes sense. The next question we have here is, do you have any recommendations on data analytics software that this attendee could use for their pharmacy, and how can they best implement data analytics into their workflows? Do they need a dedicated person to handle that?
Yeah, absolutely. So, whenever we talk about recommendations for data analytics software, we always want to put out there that we encourage you to make assessments on your own. We do have a couple here that we'll name, but don't want to go on record saying that these are the only ones out there. But some good options are FDS's My Data Smart is one option, and Green M's Pharmacy Management Analytics and Data Engineering Solutions Suite. Again, whatever you choose, you want to go through a solution that's easy to use and has features that you're seeking, and that is going to be visually stimulating output, where you can see trends at a glance rather than combing through numbers. Each of them is going to have different needs and wants as a pharmacy. So again, FDS is My Data Smart, and Green M's Pharmacy Management Analytics and Data Engineering Solutions Suite are two that we would say that you can start looking at, and then you would be able to find more specific needs for you and figure out which one makes more sense. To add for the second piece is how can I best implement data analytics, I think was the second half of it. If you're adding something to your pharmacy's workflow, you're going to want to make sure your team's on board. You're going to want to be exciting for this addition. It's change management, and it is difficult at times. You're going to be putting something where folks aren't used to seeing data. They're not going to understand the why, and that's really going to be important to get success from these type of rollouts. So the term that is used in the industry is going to be the WIFM. You have to understand that WIFM for your internal folks, and what that means is what's in it for me. So while the company might have a great solution and great data from it, if the employees don't understand what's in it for them, that WIFM is going to be lost on them. So really enforcing that and really helping them understand how this is going to make it better for them and how this is going to improve their ability to give patient care is really important. And when it comes down to, do I need additional people to handle this? It's going to be an assessment of your current data management team and staff. This may be something where, because of the solution you pick, that you're getting reporting that's clear enough that you're going to be able to not necessarily have a new FTE taking care of it. You're going to have data that's on demand and visible for the staff that you already have to make them more efficient and let them provide better patient care. So again, that'd be my recommendation is understand what you're looking to achieve, understand the WIFM for your team, and then assess the additional workflow and efficiencies you're going to gain to really evaluate, is this just a tool for my team, or is this a person that I need dedicated to interpreting and providing this information up and downstream within our facility.
Thank you so much for going through that. That makes a lot of sense. Now, the next question I have here is, this attendee is saying, I followed all these tips, tracked everything, and came up with a battle plan, but it all fell through, and now I'm stuck with not enough or too much inventory. What should I do?
Yeah, and again, it's a really good questions from the group today. You know, there's really two ways of looking at this, and we touched on, I think, both of them during the presentation, and we first have to understand why. Why do we have too much inventory? Is it because of drug shortages? And if that's the case, it's probably a little bit out of your hands to directly solve the problem because, again, because of drug shortages, we've seen pharmacies, again, buying because they want the drug versus needing the drug because they're nervous of when that's going to become available again to them. But if you have analytics that will help you report the issue to the FDA, again, there's a better chance at regulatory assistance, and this is where we can be big partners across the industry instead of just within our own facilities. It's also really important to remember that data analytics isn't a quick fix solution. Many pharmacies can and will start to see improvements quickly after analyzing important metrics, but you need time and data under your belt to make sure you're equipped to make strategic decisions. The problem that you can have now with big data is to prevent countless issues in the future. So we may have to realize that we're going to see a little bit of a ebb and flow early on as we're working to truly understand the process. The second piece, though, is if you have too much inventory or drugs becoming expired, this is where a reverse distribution partner would come back into play to help you earn some credit on that unused medication. Not the ideal situation, of course. Reverse distribution is because of inherent inventory management issues on the front end. But again, I wouldn't let one single bad scenario prevent you from learning and growing in the future. And that data that you would get from that reverse distribution partner would be another plug of big data that you would be able to look at and incorporate into your pharmacy.
Well, that is all the time we have for today. I want to thank Jeff and for his excellent presentation and the Pharma Logistics for sponsoring today's webinar. Enjoy the rest of your day, and we look forward to having you join us for future webinars.